Agents, hey, Luis Moreno here with Think Medicare, Think ACA, helping our seniors with Medicare prescription drug costs. Huge, guys. I just had a meeting yesterday with one of my seniors, taking quite a few meds, and a lot of the medications are tier threes. Man, not a good thing, but it is what it is. And we discussed some alternatives, and I'm going to share those alternatives with you so that you know what you can do with some of your seniors with some of these drug costs. All right, but before I do that, please make sure you comment, like, and please subscribe to our channel. All right, here we go.
Guys, I've got a community of ACA and Medicare agents that we're putting together. 25 years in business is what I'm going to be sharing with you. Guys, come join us at the community, a community of ACA and Medicare agents, and we'll show you how to grow.
So number one, guys, I guess before we do that, let's set the stage here. Let's talk a little bit about how the prescription drug engine works when compared to the previous years. It's completely changed for 2025. So number one, as a Medicare agent, you need to be aware of how the Medicare prescription drug engine changed in a PDP or an MAPD. Okay. All right. So this is how it changed, guys. And I'm going to give you the dumbed down version, kind of how I explain it to my seniors. It's like, look, in the past, guys, last year and prior years, here's what happened. You had a out of pocket that you'd have to pay, it's in the $8,000 range. Here's the beautiful thing going forward. Now, instead of possibly being out $8,000, and it's not.
This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information.
A whole 8,000. But anyway, I let the carriers coordinate that with the insureds. But the true out of pocket, $8,000 with the plan 2025 going forward, it's now $2,000. It's a really, really good thing. Now, I want to let you know also that the $6,000 in savings that you are getting, Mr. Senior, that was pushed on to the carrier. The insurance company has to eat that. Now, because they're eating that, some of the benefits aren't as rich like they used to be. You're probably going to see some decreases in some of the extra benefits and potentially also in higher costs for medical, potentially. Okay. Also, here's another good thing about these changes to the prescription engine is that 2024 and before, you had a donut hole, and this donut hole was not a good thing. Okay. When you were in the donut hole, at least for 2024, you had to pay 25% of the cost of the drugs. Not a good thing. You're like, well, if it's a $10 drug, it's $2.50. You're like, oh, whatever. But what if it was a $1,000 drug and you were paying, maybe it was a tier 3 and you were paying $47 and now you got to pay $250? These seniors are going to freak out. Okay, well, there's no more donut hole. That's gone. So that's a good thing. Now, the deductible did go up, but here's the good thing. The deductible is part of the $2,000. So you don't have to really spend a full $2,000 depending on your drugs. You may, this $590 is going to reduce this $2,000 because they're assuming you're going to pay it if you get some drugs that have a deductible that are part of a tier. So overall, it's a really, really good thing, Mr. Senior. But here's what we can do to help you out and alleviate some of these costs of these drugs. All right. So you need to be aware of these options. The easiest thing, at least from our point of view, is to switch from brand name to generics if it's available. Boom. Okay. Generics, tier 1, tier 2s, they probably be with zero cost, no deductible. They're going to be great. But sometimes maybe they can't. There's not a generic that's available, or maybe their body doesn't react to the generic version, whether it's a real reaction or a mental reaction. Who knows? It just doesn't work for them. So they want to stick to the brand name. So I guess on the surface, on the high level, sure, change to generics. Okay, great. Go talk to your doc and see if that's a possibility. All right. that's not a possibility, then part of your research that you should be doing with your seniors is to find out if they qualify for extra help. So let's talk about the extra help first. Give me 1 minute. Got to find my screen here, guys. Sorry. Too many screens open. All right, here we go. Extra help. Come on. All right, here we go. So, what is the extra help? So, the extra help with prescription drugs, that has an acronym and they call it LIS, low income subsidy. Okay. Low income subsidy, what it does is if they qualify for low income subsidy, it changes how the prescription engine works as far as copays. It really makes a big difference to our seniors. Now, in the past, it made an even bigger difference. This year, the way the new engine works, not a huge, I mean, it's still a good thing. If they qualify, you want to get them to apply for LIS with Social Security. Okay. Now, the LIS, if they do get it, it's attached to whatever Medicare plan they have. Okay. It's not specific to a carrier. It's just something, it's a benefit that's attached, and it changes the copay structure within the drug engine to their benefit. So again, here's what it does. Extra help. It's a Medicare program to help people with limited income and resources, assets, to pay for their Part D premiums, their deductibles, the co-insurance, and other costs. It will even pay for the Part D late enrollment penalty if they have one. Okay, so they got to qualify. Now, who gets it automatically? So if they have full Medicaid, they get it automatically. So this is a one-way street. If they have Medicaid, full Medicaid, they get LIS. But I tell people, if they have LIS, it doesn't really mean they have Medicaid. Okay, only Medicaid, full Medicaid means they have LIS. So just be aware of that. Okay, so you'll get extra help automatically if you have full Medicaid, help from the state in paying your Part B premiums, or you have SSI from Social Security. All right, here are the limits for 2024. They are not out yet for 2025. So your income limit and your asset limit, the resources that you have. Okay, if you're an individual, a single filer, just you, 22,590. That's it. That's your income limit for the year. If you're married, it goes up to 30,660. If you exceed that, you don't get it. If you're below that, you get it. Okay. And then as far as your resources, if you're an individual, it's 17,220, or a married individual, married couple, 34,360. Now, what counts as these resource limits? Okay. So money in your checking, savings, or retirement accounts, stocks, bonds. You do not count your car. You don't count your home. If you own a plot where you're going to get buried in, you don't count that. Up to $1,500 that you have set aside for your burial, you don't have to count. Your furniture and your household and personal items, you don't count that. Okay. But if you've got some stocks, you've got some bonds, you've got retirement accounts, if you own a second home, that's going to probably knock you out. But if none of these amounts exceed this limit, then what you want to do is you want to go ahead and apply for the extra help. Okay. All right. Now, before we talk about applying for the extra help, I want to share with you what, if somebody gets LIS, what it does for them. Okay. Sharing with multiple screens is a pain in the butt. All right, here we go. So if somebody has the extra help, if they have LIS, they're going to fall into different levels. Level 1, level 2, level 3. Now, in 2024, level 1 was the richest level. And then level 2, level 3, level 4. 2025, now we only have 3 levels, and it's the reverse. Level 1 is the less rich. Level 2, a little more. And then level 3 is the most richest, which means they pay less. So if somebody has level 3 LIS, everything, they have a $0 deductible, and they pay $0 copays for all their meds, regardless of the tier level. If they are level 2, the deductible's gone, but they'll pay $1.60 or maybe $4.80. Still great. And then level 1, no deductible. Okay, they'll pay $4.90 or $12.50. Not bad. Okay, now, but what if their copay is 0? So they pay the $4.90? No, remember, if their copay is 0, they'll pay 0. But if their copay is $10, well, then they'll pay $4.90. Okay, so this is what LIS is going to do for them. All right. Now, how do you apply for this thing? So when you're doing your fact gathering and you find out that they do qualify, this is what you're going to do. Or some of my screens just get all jacked up and they go all over the board. All right. Here we go. All right. So where do you go and apply? So and I'm going to share these links with you, but let's get in here, and there should be a button here where to apply right here. Here we go. Apply for the extra help. You click on that. Okay, now you're on this site. This is the only site that I'm aware of that you can go and apply for the extra help. Apply now. Okay, next. Okay, now this is how I start this off. And I do it for my seniors because it's very easy and quick to do. Are you assisting? Yes, I'm assisting. Did you or your spouse get an application? Do you or your spouse have Medicare? Are you or your spouse 64 and 9 months? And remember, these questions are for them. Okay, not you, the agent. You receive Social Security? No. What state do you live in? Texas. Are you single or married? You put single. All right. Do you have a combined savings of these amounts? Okay, I'll put no. Now you'll notice that these numbers are a little bit different. I don't know how to explain that. So, you know, the site prior to this, not an issue. Now this site, different numbers, but oh well, just roll with it, okay? Now we're going to hit next. We're going to hit apply now. And you're going to start entering your information. Luis Moreno, I am other, and I put insurance agent, my phone number, my address, and then we start filling out the information on that senior. And guys, I will tell you, literally, it takes you minutes to complete. Okay, then you submit, goes to Social Security. Social Security does their thing, and they're going to get a letter. They're either going to be awarded LIS or they're going to get denied. Boom, that's it. Okay. Now there's another thing that we can do to help our seniors. And what that other thing is.
You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare Smart Books.
Here we go. Is the Medicare Prescription Payment Plan. Okay. This is something new for 2025. So this prescription payment plan is a payment option in the prescription drug law that works with your current drug coverage to help manage your out-of-pocket costs for drugs covered by your plan. And what it does is it spreads them across the year. Anyone with a drug plan or a health plan with drug coverage, like an MA plan, can use this option, and it's completely voluntary. If you select the payment option, each month you will continue to pay your premium if you have one, and you will get a bill from your health or drug plan to pay for your prescription drugs instead of the pharmacy. There's no cost other than what you have to pay. So you can help your seniors out with this. There's a video here that will explain that. 3-minute video. You can get in here, watch the video, and see if this is an option for your seniors. So that, guys, is ultimately what we can do for our seniors. when it comes to helping them out with their prescription drugs. So a very, very good thing to be aware of. Guys, make sure that you're doing this for all your seniors. Help them out, because a lot of these guys aren't flush with money. The ones that are just living on Social Security, oh, it's a hard life. I don't know how they manage, but they find a way. Okay, they're living on very limited fixed income. So helping them out with this, you may not think it's a big deal, but for them, it's a huge deal. All right, Luis Moreno, Think Medicare, Think ACA. Hope this helps you out. Give me a thumbs up, subscribe, give me some comments down below. Don't forget, lots of goodies down there for you Medicare agents and even you ACA agents. I have the Medicare Smart Book and the ACA Smart Book in English and Spanish. It's a manual. Guys, it's like a must-have manual, okay? I update it. You buy it one time, you never have to worry about it paying for it again. I keep updating it every single year. Second, guys, if you want to sell ACA, I have an ACA 101 course. It's a great freaking course. Think about that. Third, I have the CRM. Oh, man, this CRM, guys, it is my biggest money maker. Not only that, but it saves me on employee costs, because this thing only costs me $97 a month. Use my link, guys, and you get all of my workflows. Since we're talking about Medicare, the workflow that makes me a ton of money. Number one, what it is, it helps me out by identifying people that are about to turn 65. If I put their date of birth, what it does is it helps me identify who they are 6 months before they turn 65. And it sends me an email, notifies me. It starts prepping them for the enrollment in Medicare for Part A and Part B. And then I get my own turning 65 list. It's huge. So that's just one of many workflows that I have. And then finally, guys, I've got the community. You may want to consider joining our community, guys. It is a group of Medicare and ACA agents, and I'm doing all of my training that I do for my current contracted agents. I'm doing for agents that aren't mine, but that belong to the community. And we're doing so much more in that community. It's training, it's support, it's stuff that you probably don't have out there that you may be wanting. And it's also a platform where you can ask questions. We've got agents in there that will chime in and help you out. We're just really doing a lot. So consider joining our community. It's $50 a month. I don't know. I take my kids to Chick-fil-A, and just that, you're feeding those 3 little suckers, I'm over $50. So it'd definitely be worth it for you if you're out there just sitting on an island and you got no support, you got nobody to chit chat with, and you're just there. So all the links are down below. Guys, this is Luis Moreno with Think Medicare, Think ACA. Don't forget, like, comment, and please subscribe to the channel.